Hi, everyone. My name is Chef Jessica Van Roo. I am the executive chef of the Susan Samueli Integrative Health Institute at the University of California, Irvine. I have been teaching culinary arts for the last 15 years, and my focus has been on culinary medicine for the last 8 years. Our goal in culinary medicine is to empower doctors, patients, and the community to make better food choices through the exploration of cooking and eating together. Today, I will be discussing high blood pressure as well as some fun recipes that you can incorporate into your daily life. So first, what is blood pressure, and specifically high blood pressure? Blood pressure measures the force used against the walls of the heart's vessels, your arteries, when the heart pumps blood through them. The typical normal blood pressure on average is lower than 120/80. However, for some individuals, this normal range may vary. Your doctor will help you determine which of these numbers is the best goal for you. High blood pressure is also known as hypertension. Hypertension is your blood pressure elevated beyond the desired range. When your blood pressure remains consistently high for an extended period, you may be at risk of various complications, such as heart attacks, strokes, and kidney disease. So what affects high blood pressure? There are several factors, and they can include your lifestyle, like lack of physical activity, excessive alcohol consumption, and smoking. Your genetics, a family history of hypertension can increase your risk. Your age, blood pressure tends to rise with age. And the one we are going to be discussing more is your diet. Consuming too much salt, saturated fats, and not enough fruits and vegetables will also make an impact. Let's focus on the salt component of your diet for a moment. Salt, scientifically known as sodium chloride, is a common ingredient in our diet. It adds flavor to our food and is essential for various bodily functions. However, consuming too much salt can be harmful. Remember, high blood pressure or hypertension occurs when the force of the blood against the artery walls is consistently too high. Now, here's the link. Salt attracts water. So when you consume excess salt, your body retains more water. This extra fluid in your bloodstream then increases the volume of blood, which in turn raises your blood pressure. Imagine your arteries as pipes. When you have high blood pressure, it's like putting additional pressure on those pipes, making them less flexible and more vulnerable to damage. So, what's the recommended daily amount of sodium? Experts suggest that most adults do not exceed 2,000 milligrams per day. That's about a teaspoon of salt. However, the ideal goal is even lower, around 1,500 milligrams per day for specific groups, such as people with high blood pressure or older adults. So what are the culprits of salt other than salt itself? Many processed and restaurant foods are loaded with hidden salt. Common culprits include prepackaged foods such as canned soups, snacks, fast food, and even seemingly healthy foods such as bread and cereal. In the food industry, both salt and sugar provide more than flavor. They are also used as preservatives. The good news is that reducing your salt intake can have a significant impact on managing high blood pressure. When you lower sodium intake, your body retains less water, which reduces the volume of blood and ultimately eases the pressure on your arteries. So here's some practical tips to reduce your salt intake. Start reading labels. Pay attention to food labels for sodium content. Cook at home. Prepare meals at home allows you to control the amount of salt in your dishes. Use herbs and spices. Experiment with herbs and spices to add flavor without the extra salt. Limit your processed foods, so minimize fast food or processed foods in your diet. And choose low sodium options when you're dining out. Sometimes on menus, they will have options for you that are labeled low sodium. Which then leads me to talk about the DASH diet. So what is the DASH diet? DASH stands for Dietary Approaches to Stop Hypertension. The DASH diet is a dietary plan specifically designed to help control and prevent high blood pressure. The DASH diet emphasizes several key principles. It encourages a daily intake of fruits and vegetables, which are rich in essential nutrients, fiber, and antioxidants. It encourages whole grains like brown rice, whole wheat bread, and oats over things that are refined, such as white bread or white rice and white pasta. It suggests choosing lean protein, sources like poultry, fish, beans, and nuts instead of red meat. When choosing dairy on the DASH diet, also look for low fat or fat-free dairy products, which are preferred over full fat and full dairy for their calcium content and protein. The DASH diet keeps sodium intake in check. They usually suggest below 2,300 milligrams per day, or again, about 1 teaspoon of salt. So how does the DASH diet help high blood pressure? If you think about it, it's all about those nutrients we just talked about. By prioritizing these nutrient-rich foods and reducing sodium, the DASH diet helps to lower blood pressure. The effectiveness of the DASH diet isn't just a theory. It's backed by scientific research. Studies have shown that those following the DASH diet can lead to significant reductions in blood pressure, particularly in those with hypertension. Starting the DASH diet and creating it and implementing it into your daily life isn't as daunting as it may seem. And here's some ways to get started. First of all, I never want you to just completely change your diet right away. Make gradual changes to your eating habits. Plan your meals. When you actually look at them, you can add the fruits and vegetables and whole grains that you normally might not. Minimize processed and packaged foods because they often have those high levels of sodium. Pay attention to nutrition labels for sodium content when shopping. Prepare your meals at home because they then allow you more control over your ingredients and therefore your sodium levels. The DASH diet is a powerful tool for managing your blood pressure. And by focusing on these whole nutrient-rich foods and reducing sodium intake, you can take significant steps toward improving your heart health. So now that you know how to begin to improve your diet, let's dig a little deeper and look at the food labeling. When examining a food label, the first thing to check is the serving size. This sets the stage for the rest of the information. The sodium content listed on the label is typically for 1 serving of the product. Be aware that your portion may be more or less than the serving size. Next, look at the sodium content itself, usually expressed in milligrams or mg. This number tells you how much sodium is in 1 serving of the food. Please pay close attention to this figure as it directly impacts your sodium intake. On the label, you'll often see percent daily value or percent DV next to the sodium content. This percentage tells you how much of your daily recommended sodium intake 1 serving of the food provides. But keep in mind that percent daily value is based on a daily intake of 2,300 milligrams of sodium, which is at the very, very upper limit for most adults. So how do you understand all of that? Here's an easy way. 5% or less means the product is low in sodium. 20% or more indicates a high sodium product. Sodium can also go by different names on labels, such as sodium chloride, monosodium glutamate, MSG, baking soda, and more. If you see these, they contribute to overall sodium content. Remember to look past the nutrition label to the ingredient list. Sodium-containing ingredients are often hidden, especially in processed and packaged foods. Look for items like sodium bicarbonate or sodium nitrate. Here's some labeling considerations. So a few more. No salt means there's no sodium added to the food, but remember, food may still contain sodium naturally. Sodium-free means a serving has less than 5 milligrams of sodium. Low sodium means a serving has 140 milligrams or less of sodium. Lower sodium and reduced sodium mean that there is at least 25% less sodium than what the food normally has. Lightly salted means that the fruit provides at least 50% less sodium than what the food normally has. Now that you have this knowledge, you can be a smarter shopper. Choose foods with lower sodium content. Opt for products labeled low sodium or no salt added, and prioritize whole fresh foods that naturally contain less sodium. So, how do we make the food taste good if we want to reduce our salt consumption? One of the simplest ways to boost flavor is by using a variety of herbs and spices. Herbs and spices can add depth and complexity to your meals. Some other examples are citrus zest, like lime or lemon. They can give you a little burst of brightness and aroma when you might want salt. So just grate some of that skin into a dish and see how it enhances it. Vinegars like balsamic or apple cider vinegar give you like a nice tang. So drizzle some on top of roasted veggies or a salad. You can also incorporate umami-rich ingredients. So the two ingredients that I like to add that are amazing at providing umami are mushrooms and tomatoes. They can lead to a savory depth in your dish without that excess sodium. There's also cooking techniques that can build flavor. Roasting and caramelizing intensifies flavors and actually leads you to use less salt then. You don't need to rely on salt to make food taste great. Experiment with herbs, spices, citrus zest, vinegar, umami ingredients, and cooking techniques, and they will all help enhance flavor and create delicious, healthier meals. So let's get cooking now.